This I always call it as a supplement, right? So your LRR is going to be a supplement to RR. First thing you have to note. Second, what all are we going to cover in this rapid revision, this LRR? So this is not going to cover all those topics which we had discussed in the INI CET ones. Those were separate. I have kept the topics in this LRR which are important for two exams. Number one, NEET PG, and number two, that is FMG. So this is a combined LRR for both the students. We know that 85 to 90% of both the exam patterns are the same now. 10%, I agree, I would put a plus 10% to NEET PG. So if I feel that something is a little extra for FMG and you don't need to know that, I will mention it. As I teach, I will mention it that yahan tak it is important and beyond this it is not important. So you guys decide and you just need to listen to that carefully, and that's about it. After this, there is no other LRR that you have to watch. You don't have to go back and start viewing, for NEET PG. You don't have to see anything else. You have to do your RR, you have to do your LRR, and I think if you can manage to finish this much, you are settled. After that, there's no problem that should come in your way. Hopefully, fingers crossed. Okay. Now, two things. Now, this is our first pathology LRR on the app. So everyone can see there is a chat box. Now you guys prefer not to send the thumbs up and the emoticons because that is unnecessarily filling up the chat and that will make me miss out on your doubts and your comments, and I don't want to do that. So it's better that, although usually I would love to hear that motivation from all of you, but in this platform, in this format, it is better that we don't press on that emoticon so that I can actually focus on what you want to write to me, ask me or answer. That is what is going to be the one. And annotated PDF, all of you know, once the session is over, yahin par you will be able to download it. So I've got you some frequently asked questions. Is LRR enough? I've already told you it's a combination of both RR as well as LRR. Second, is this for all exam patterns? Yes, but primarily focusing more on FMG and NEET. Will you get a PDF? Yes, you will, but after the class is over. So now you are not going to ask me these questions. Now what are you going to do? I've kept a target of 2 hours and 15 minutes to be very precise, where you have to only focus on kya padna hai. You don't have to focus on PDF kahan se milega, what is going to happen, app, etc., etc. Put everything away and focus only and only on the thing that is over here being taught. You can't download the app, Dr. Anamika, you are right, but you can't download it for personal, I mean in your desktop or in your downloads folder, but anytime you can come here and you can view it. That will always be open. Okay. Chalo, now you will be able to not focus on anything else because I'm going to give you a rapid fire of a lot of things. So tell me this, guys, these are all the topics that I have kept, and this is a very vague, basic topics. I am going to actually teach you more than this. So this is just to give you a little bit of an idea that this is what we cover in today's class, which means today's class is primarily going to be all of systemic path, and tomorrow we will be having the hemat section and the GP, general path section goes on tomorrow. So aaj hame pura, we are going to finish systemic. Okay. Now after this, anything else that you have as questions, not right now, nothing for 2 hours, 15 minutes, only pure brainstorming studies. After that, you want me to spend half an hour, 1 hour in solving your doubts, your queries, your strategies, I'm there. But pehle 2 hours, 15 minutes, you are not going to ask me anything apart from only brainstorming session. And the first question, I'm going to start with a topic which all of you have not seen in RR because that is in the image section and all of you tend to ignore it a lot. So starting with what you need to know and you never study. So that is the topic first. Let's get going. Everyone focus only, no thumbs up, no emoticons, please. Genuine messages, genuine comments and answers only. Let's start. Cancer detected in one breast that needs to be screened in the contralateral breast. So one breast and contralateral means the cancer that tends to be bilateral is going to be what? It is going to be the option B. I've started getting ductal carcinoma. No. The correct answer over here, option A. Exactly. That is lobular carcinoma. So as I said, we never ever pay any attention. Today we will focus more on invasive. I'm not focusing on anything else. There are two types of cancers in the breast. This everyone knows. One is going to be a ductal carcinoma of the breast and the other one is going to be lobular carcinoma breast. I am focusing on lobular carcinoma. I think everyone knows the picture of lobular carcinoma. It shows you like the Indian Army. Indian Army is very disciplined. They are standing one behind the other. So tumor cells are standing one behind the other. So what do you call it? Like the Indian Army, Indian file pattern. They are standing one behind the other. That is question number one. Question number two. How will the patient present? This tumor has two properties, bilateral and multicentric. Always? No. Can be bilateral and can be multicentric. Every patient is not going to come to you with a lobular carcinoma of left and right breast. So I just mean to say that if you have a lobular carcinoma in one breast, should you keep her in follow-up and keep screening the contralateral breast? Yes. Okay. So number one, Indian file pattern. Excellent. Next, what is the genetic alteration? There is a down regulation of E-cadherin. Exam mein ye nahi hoga. This won't be there. They will write CDH gene. So you should be able to focus it from here. CDH is nothing but E-cadherin. So now all of you know that Golu mnemonic from your RR videos that ma'am, what is E-cadherin? E-cadherin is like a Fevicol. It's like a glue. It keeps all the cells together. I am saying glue is gone. So if the glue is gone, what are the two tumors? Go-Lu tumors. I think the first one all of you have already answered, lobular carcinoma. And G for which cancer? Diffuse. Go for gastric. Diffuse gastric cancer, right? So glue gaya, Go-Lu tumors hoga. Gastric cancer hoga, lobular cancer hoga. Question number one, the easiest one is settled for us. It tends to be bilateral. Now let's move on to the next question, which again is a PY2 for NEET and FMG. There's a 24 who presented with a left-sided breast lump for the last 2 months. Soft, mobile, non-tender, and histopathology has been shown over here. What is your diagnosis? Very good. I can see very clearly that the answer started coming up over here is fibroadenoma, and phyllodes में confusion है. So the answer over here is fibroadenoma. Why? Now you are not totally wrong. For all of those who thought ना phyllodes भी हो सकता है, can phyllodes occur at 24 years? It can. Can it be soft, mobile, non-tender? सब कुछ same चल सकता है. picture over here. So the answer to this question is fibroadenoma. Today, from your surgery point of view, I will clear this confusion once and for all. These are the 3 pictures that I have got for the famous tumor that you are telling me that is fibroadenoma. Before you tell me, I will ask you something. That what is, before you tell me histopath, let me ask you the ultrasound findings. Any calcification that you see? There's a very famous calcification on ultrasound that you see in fibroadenoma, that is popcorn calcification. One more thing I will ask you. What else can you see? The radiologist says that the lump is very mobile, so you call it a breast mouse. They say, radiologist says that whenever I keep the probe, the lump slips. Then I keep the probe again, the lump slips. So the radiologist finds it very difficult to hold it at one place. It keeps running around. So you call it a breast mouse and you see popcorn calcification. That is fibroadenoma. Now let me tell you the pathology part of it. So look at this. Sabse pehle, ma'am, breast lump. The first thing you would want to do is FNAC. Very good. FNAC mein, can you see these clusters? Everyone, these are a little like the horns of a deer. If you look at the horns of a deer, they are like this. The horns of a deer, matlab stag horn clusters are seen on FNAC. If this word is written, it is pakka 5. This is FS. What are these 2 pictures? Finally, surgery hua, excision hua, biopsy hua. 2 patterns can be seen. Can we all notice the first pattern? How are the ducts? Dekho, 2 options hai. Either the ducts are going to be like this, pitch cover, like compressed, or they are going to be open. I don't have any other option, compressed or open. So if they are compressed, can you see they are like someone has pitched out them? Okay, someone has squeezed them together. So what do you call it? Intracanalicular fibroadenoma. If they are open like this, then you are going to call it, like, look at these are open. You can see a white space. Open hai to pericanalicular. How do I learn this for the exam? Intracanalicular mein I pitch cover duct, pericanalicular mein it's open, so the open duct. What is the photo over here? Can anyone tell me, is this intra or peri? I think you are smart enough, ma'am. These are pitch cover ducts, so this is going to be intracanalicular fibroadenoma. Does it make any 1% difference in the patient's life whether it is intra or peri? No, ma'am. This is pathologist ka show off. It doesn't make any difference in the patient's life. Prognosis of both is excellent and both is the same. So whether you write intra or peri, patient does not care much. Okay. So this is these 3 pictures: staghorn, intracanalicular, pericanalicular. These 3 photos given. What is your answer in the exam? Fibroadenoma. Whereas now if the examiner gives you this leaf, if he says aisa kuch leaf ban raha hai, so what is that going to be? Now that is Phyllodes tumor, because you guys can guess on your own. Na phylum matlab kya? Phylum matlab leaf. So now how many types? I started with the surgery path integration today because I know this is the most ignored topic that you have, guys. So tell me, Phyllodes tumor mein phylum, leaf, ma'am, that we understood. How many types do you have? So please remember, Phyllodes tumor is of 3 types: benign, borderline, malignant. So can you let me know that fibroadenoma ko which one are you confusing it with? Obviously, ma'am, fibroadenoma to benign hai. So when I say confusion hua, I am confusing it with benign. Tell me from your point of view of your, of course, surgery, how do you define malignant Phyllodes? What is cutoff? More than 10 per 10 high power field mitosis. More than 10 per 10 high power field mitosis is malignant Phyllodes. I'll give you one thing from surgery and gynae, then I'll go into real pathology. Please note, ma'am, 2 places, one in surgery and one in OBGY, jahan pe ye same cheez aati hai, that more than 10 per 10 high power field mitosis are important. In surgery, you have studied which Phyllodes? Obviously, is going to be the malignant Phyllodes tumor. Whereas in gynae, who will tell me one gynae tumor? Of course, I'm talking about uterus, cervix and all. Leiomyosarcoma of the uterus. Leiomyosarcoma, of course, is going to be in the uterus only in gynae. Usme bhi the mitotic cutoff, if you go and see today in your gynae books, it is 10 per 10 high power field. Is this okay? This correlation with other subjects is done. Now you know this was the fibroadenoma. For those who answered Phyllodes, Phyllodes nahi tha, it's not a ductal cancer also. Question number 2 is also done. Now we move on to the next question. I'm in the same organ still. What is this? A 55-year-old woman presents with a painless palpable mass in her left breast, loss of appetite, recent weight loss. Mammography has revealed a mass with radiolucent centers. Excision biopsy ka photo is given. Soft, rubbery, grey, gelatinous. What is the answer? I've started getting an answer of A, that is colloid carcinoma. Firstly, they are talking about breast, and breast doesn't have colloid. Thyroid has colloid. So in the breast, when they talk about colloid, that is the other name of mucinous carcinoma of the breast. And now this word will make sense, that when I say mucinous, it's going to have lots and lots of mucin. Ma'am, did you guys notice? And this I'm teaching you from surgery point of view. They are talking about carcinoma, carcinoma, carcinoma. How does carcinoma appear on a lamination? Carcinoma has to be palpation of every cancer is, but over here if you see, the carcinoma description is soft, rubbery. Why? Because it's got a lot of mucin, ma'am, it's got a lot of jelly. Because of it, the carcinoma is not looking like a carcinoma. Surgeon will feel maybe it is benign, but the pathologist will see that no, over here, can you see a sari khali jagah? White. These are all very good. Many of you call these pools of mucin, ma'am. Yes. Where is the cancer then? This is the cancer. Ye chota tumor cells. These small clusters, these are tumor cells in pools of mucin. That is how you describe. One question for INI-CET aspirants that I'm going to ask. Can you let me know what is this? So ye niche wala photo to you know. This you already understood, ma'am. This you just taught us. Ye tha mucinous carcinoma of the breast. Ye aapne bata diya. But what is this photo on the top? This is also mucinous carcinoma breast. What is the difference? This is a picture of FNAC, and this is for INI-CET students only. What is this, ma'am? It's looking like jaisa hum earphones hota tha na. Now obviously all of us have moved into the era of wireless, but wired earphones used to get all entangled in our bags and all. So same way, entangled vessels, matlab these we call as chicken wire blood vessels. The FMG students need not learn this. NEET and INI students have to. So 2 things, ma'am. Both of them are mucinous carcinoma. Ye wala photo diya means this is a case of biopsy, and ye wala photo diya, this is a case of FNAC. So this is very settled for me. This was a biopsy, same photo, mucinous carcinoma. Other name is colloid carcinoma. Could you see one more photo on that same page which I was trying to hide? If the breast looks like this, can you tell me which cancer is this so that I can teach you about it? Ma'am, this is not looking like the breast. This is looking like an orange peel. All of you know it. Come on. As soon as they say there is an orange peel appearance, very good. This is Dr. Dharmesh. Of course, it is going to be. It is live only, right? So what is this? This is orange peel, ma'am. Would that dot, dimpling I can see. Yes. So if this photo would have been given, for example, orange peel ka photo hota, what is the answer that you would have selected then? That pure orange appearance, right? That pure orange appearance is nothing but the inflammatory carcinoma. And now the question that came, PYQ bata do. Why are those dot dimples being seen? Because the subdermal lymphatics are being affected. The cancer has gone where? The cancer has gone in the subdermal lymphatics. Very good. I can see that. So yeah, all settled. Subdermal lymphatics cells have come into it. Amazing. So pure orange is something all of you were well aware of. Chalo, this is also done. Now I'll ask you the last question. So abhi tak humne mucinous carcinoma we have studied, then this inflammatory carcinoma we have studied, starting with that Indian file pattern lobular carcinoma we studied. Now if you studied everything, then all of you will give me the answer to this. 50-year-old woman underwent a breast biopsy because she had a breast mass. Histopathology mein lymphocytes and plasma cells are seen. IHC tumor is also there, and negative for ER, PR and HER2 new. What is the most likely subtype? Okay, so ma'am, there's some cancer, I know, some tumor and some cancer is happening over here. Jisme some inflammation is also there, lymphocytes and plasma cells are there, and it is triple negative. Everything is negative. So which out of these tends to be triple negative? Very good. Surgery question again. Medullary carcinoma. So jab sab padha to give me 5 minutes and finish off this also. What am I talking about? I am talking about the classification of breast cancer. Before I start, all of you will tell me what is the basis, PYQ. Now guys, in today's class, I am not going to write PYQ everywhere and make your PDF even bulky, because whatever I am teaching you is either very high yielding potential or is a PYQ. So मान के चलो this PDF is PYQ PDF and potential PDF. So we will now not waste time in writing PYQs again. Okay. So what is the basis? ये कैसे हुआ? Ma'am, although over here you are writing ER, PR, HER2/neu everywhere, and ER, PR, HER2/neu कैसे measure होता है? In the previous question it was written. It is measured by immunohistochemistry. But is this classification based on immunohistochemistry? No. The classification is based on very good. All of you gave me a very good answer over here. Gene expression profiling matlab this classification is based on genetics. They did gene analysis and then they gave this classification. After that we started putting IHC. So classification mein option A will be IHC. Will you select that? No. Option B will be gene expression profiling. This is selected? Yes. Now tell me, what are the four types? What are the four types? Luminal A, B, HER2/neu and triple negative. So common sense, triple negative mein everything is going to be negative. Yes. HER2 mein what is going to be positive? Only HER2 will be positive. Baki sab negative. So in HER2 rich, if only HER2 is positive, that means in the others, ma'am, others will be positive. Means ER, PR positive, HER2 negative, ER, PR positive, HER2 negative. Then luminal A and luminal B are looking the same. ER, PR positive, HER2 negative. So how do I differentiate? I differentiate on the basis of Ki67. If it is less than 14%, it is luminal A, and if it is more than 14%, it is going to be luminal B, right? And all of those, see, we have a habit, things will keep changing, not just with apps, not just with exams, with everywhere you go in life. You have two options. Number one, either you can sit and think over, okay, this because this changed and that is why I'm not doing good, or you can adapt to whatever is happening around you. And I do understand most of you want that PDF download ho jaye, YouTube pe aa jaye, 2x ho jaye, 2.5x also students have written to me. So either you can focus all your attention on how better another app can become, or you can say that, now is probably the last 1 month, 20 days before INI, less than 2 months for my NEET. Now all this feedback I should give, but at the end of the day, I should not let my studies suffer because of it. So jo best mil raha hai, that is what you have to adapt to. This is a very, not an app-based advice. I'm giving you a very personal as a mentor and advice that I'm giving you for your exam because I have believed in it. This is just one problem. You will have a million problems. Abhi, there are so many students I know jinka backup nahi hota, their app crashes, their phone crashes, their PDFs are lost. So I always tell them, either you sulk over that, or you now just download those PDFs again, spend half a day and start studying. Your life, your choices that you have to make. And that is my only advice to you. That is that please, problems will keep happening. This is one problem that you might be feeling right now कि अच्छा app में changes हो गए हैं, or these some problems will come otherwise also. किसी का admit card नहीं download होगा, you will not find the appropriate center that you wanted. So many problems come along this journey. As I said, your two options, you decide. There is no third option. Either you adapt, you fit into it, you fit into the adversities and you sail through, or you take it as a reason for not sailing through. And I'm sure all of you, okay? So let's move forward. When I say luminal A and luminal B, Ki67 less than 14% in luminal A and more than 14% in luminal B. Okay. So now let's move forward. What are the options that I'll have? When I say triple negative, NE for negative, ME for medullary, ME for metaplastic. These will come in triple negative. What will come in HER2 rich? HER2 rich mein aayega happy and rich. Of course, all of us will be happy and rich. We will be happy when we become rich. So what is that happy cream? We call it hapocrene. Matlab happy and rich. Hapocrene is HER2/neu rich. After that, ma'am, dustbin category जिसमें सब कुछ आता है, tubular, mucinous, colloid, all these others go in luminal A. But as soon as I say Ki67 more than 14%, something becomes high grade. High grade is going to be luminal B. So if they say lobular carcinoma low grade, it is luminal A. If they say high grade, that is luminal B. Come back to the question. The question was that over here it is triple negative, ma'am. NE for negative, ME for medullary, and that was my answer. Can you quickly tell me बाकी सब कौन सा category है? Colloid and mucinous are the same, and tubular, all these others are going to come into the category of luminal A. ठीक है? Yes. Okay, so this is also settled. I believe now we can finish this topic once and for all and go on to the next set of questions. This was the first topic. I was going a little slow, original 1x. Now what I do, I make myself go into 1.5x because abhi sab adjust ho gaye, sab everyone settled down. Now we will have to make it a little faster. Everyone's ready for it? Let's start. Which of the following statements about giant cell arteritis is true? And I think every answer of giant cell matlab ma'am granuloma. And now look at the others. Is the most common artery abdominal aorta? No, what is the other name of giant cell arteritis? It is temporal arteritis. This means the most common artery is the superficial temporal artery, not the abdominal aorta. What is the most common symptom? Yahan pe dekho, temporal artery matlab most common symptom is going to be extreme headache in this area, unilateral headache. Most common. What is most specific? Most specific is going to be jaw claudication. Pain in the jaw will be the most specific, but what is the most dangerous? Once it happens and we are gone, loss of vision, blindness is going to be the most dangerous. So these are the set of symptoms. And obviously ma'am, temporal matlab temporal artery, and giant cell matlab I am going to see what microscopically lots of. One more thing with giant, what is the age? Patient is also giant. That is, it's going to happen after 50 years of age. It is the most common vasculitis in adults. Now, one question, two questions from surgery and medicine. Biopsy में कितना centimeters का biopsy do you take? So when I take a biopsy, we prefer that I take 3 to 5 centimeters. Many books mention 1 centimeter. The latest guidelines say 3 to 5 centimeters because they are saying that this condition is nodular. It might be seen over here, it might not be seen over here. So if you take 1 centimeter, you will miss it. 3 to 5 centimeters you have to take. And next, what is the treatment? The treatment is that you have to start with steroids. Not just that, you have to start with steroids. Stat ASAP. Do not wait for anything. So coming back to the question, is it continuous? No, it is nodular involvement. Patchy nodular involvement. Is it a small arthritis? Of course not. It is a large vessel arthritis or large vessel vasculitis. So now asking you, under large vessel you had T and T, temporal हो गया. If now they just change the age, giant की बजाय they say patient is less than 50 years and pulseless disease, which means the upper limb pulse is very very weak. Less than 50 years with weak upper limb pulse, and you know your answer will become Takayasu. उसमें vessel क्या होगा? I can see that ma'am, the arch of aorta is going to be affected, but most common vessel affected in the arch of aorta is going to be very good subclavian. All of you have successfully finished the T and T. Sometimes I'll give you one example. Sometimes what will happen? They will say there is a vasculitis. दोनों patients में ma'am headache can happen. So there's a vasculitis and there is headache, and they say it is a large vessel vasculitis. दोनों में headache है. What do I select? This T or this T? Look at the age. Above 50 हुआ mark temporal. Below 50 हुआ mark Takayasu. If both of them have the same symptoms of headache, go by the age in that case. Now let's move on to the next question. The next question that you have is this: a 39-year-old female presented with complaints of headache, fever, and pain in the upper extremities with use of some medication for 3 weeks. Okay, there's a suspicion of autoimmune vasculitis, and arteriography reveals involvement of thoracic aorta. Which of the following is the suspected part of it? Yes, most of you are right now. Takayasu, because ma'am, जब aorta आएगा, Takayasu is the person less than 50 years. Yes, it is. So all of this seems to be falling very much in place. Next question. Which of the following conditions is associated with the vasculitis of the histopathology shown below? I assume everyone has guessed that this is a blood vessel, and in this blood vessel you have something which is showing you as a pink color band, which is our general path, that is fibrinoid necrosis. Many of you are right. Fibrinoid necrosis and blood vessel, matlab the disease is polyarthritis nodosa, and 30% cases of polyarthritis nodosa are HBV. Which antigen of HBV will be found over here is your question from micro. 3 antigens होते हैं ना, surface, core and pre-core. So that is going to be the surface antigen which is going to be found over here. Okay, so HBS AG is going to be positive, not the other antigens of HBV that you find. So now when you said polyarthritis nodosa, what vasculitis is it? It is a kind of a vasculitis, all of you know the mnemonic pan khata bacha, right? So pan, khata and bacha. Tell me that one point quickly in a minute how you will differentiate. Man, pan ka polyarthritis nodosa ka you already told me viral marker is hepatitis B surface antigen. Most common vessel is the kidney, but does glomerulonephritis happen? No, never ever. Kidney involved hoga, glomerulonephritis nahi hoga to kya hoga? Who will tell me this? Glomerulonephritis nahi hua, but then what happened? I hope you remember we had a mnemonic called flea bitten kidney. We hate PSM. I will be teaching you today. So we hate PSM. P is polyarthritis nodosa. It shows you flea bitten kidney. What is the vessel spared? So ma'am, P is not for P. So pulmonary vessel is not going to be affected. Necrosis we have already seen. This is a case of fibrinoid necrosis. So this is also settled. Now Kawasaki, I think no one will ever have a problem because Kawasaki is strawberry tongue appearance and no one forgets. Extra question kya aayega? They will ask you latest update. Which antibody is found in Kawasaki disease? It is the anti-endothelial cell antibodies. This is something they will be asking you. I think this is the potential exam question for this time. Kawasaki is anti-endothelial cell antibody. Don't miss out on this point at all. Okay, this was your last year's PY2 FMG and NEET. Burgers disease. Ma'am, as soon as you say Burgers, B for Burgers, B for BD or any kind of cigarette smoking, they ask you the other name. It is thromboangiitis obliterans. Very good. TAO. And thromboangiitis obliterans, ma'am, itis, obliterans, angiitis, blood vessels, artery affected, vein affected, nerve also affected. What is never affected is going to be your lymphatics. Very, very good. Dr. Zishan is saying, ma'am, scarlet fever also shows you strawberry tongue. Jo topics I feel you have sabne sun ke they've studied it so many times. Those I'm kind of skipping because everyone knows that other than Kawasaki, this is also seen in scarlet fever. Okay, now coming back. Other name is asked, they asked you lymphatics never involved and iska treatment पूछेंगे. There is no drug that you have to give. The only treatment that you have in this case is going to be stop smoking. That's it, smoking cessation. So now answer a question on the basis of this. A man who's admitted with complaints of pain in the lower limbs and blackening, तो gangrene भी शुरू हो चुका है. There is a very strong history of smoking that is present. Otherwise, if you see anti-nuclear antibodies are not there, biopsy is shown and you know the answer is which of the following would never be affected. So I just told you that smoking आया, but in the exam, guys, remember right now you know we are doing blood vessel chapter, तो सबका था कि Burgers and lymphatics never affected. But in exam you will not know this is the concept of blood vessel. So you will have to look at the picture. They will say that there is something biopsy that has been shown. Tell me, is it looking like a blood vessel? नहीं लग रहा. Ma'am, blood vessel gone, पूरा filled. That is what you're studying. Blood vessel is obliterated. Thromboangiitis obliterans. This is not looking like a blood vessel. Is that okay? So lymphatic channels would never be affected because this is Burgers. I'm reminding you one last time. This Burgers that we are doing is the U wala Burgers because that is what is vasculitis. After half an hour I will teach you one bina U wala Burgers. That will be the Burgers in kidney. Very good. So the one Dr. Vaishnavi, nahi, the Burgers with U is this. You've written it shayad ulta by mistake. So Burgers U wala is V wala. Without the U is going to be IgA nephropathy. Okay, let's move forward to the next question. Lengthy question, but I think you'll be able to get it. 23-year-old man presents with complaints of nasal obstruction, serosanguinous discharge, cough with bloody sputum over 1 month. Chest X-ray shows cavitatory lesions. There are nodules in the lung fields. Then there are obviously involvement of sinuses. Urine analysis shows you kidney involvement. क्या involved हुआ? Kidney involved हुआ है, ma'am. Lungs involved हुआ है, and nose has been affected over here. Along with that, elevated C ANCA. Before I get going to anything else, I want to show you. I know everyone has given me an answer of vaginous. I'll come back to this question. The most important thing in the exam will be ANCA, and आजकल का most potential expected question है. Listen to this very carefully for 2 minutes, okay? When I say ANCA, it is anti-neutrophil cytoplasmic antibody. Ma'am, you are testing for an antibody. पहला point. C ANCA, P ANCA. I think this much everyone knows. C ANCA matlab C for what? It is cytoplasmic ANCA, and P ANCA stands for perinuclear ANCA, and they've got new names. P ANCA known as MPO ANCA, C ANCA known as PR3 ANCA. Confuse nahi hona exam mein. When you are about to crash, who will save you? CPR will save you. So remember, C ANCA is going to be PR3 ANCA, and there is only one disease that comes under it. We learn it as World Cup also. Many students learn it as World Cup or Wipro. So World Cup matlab vaginous mein kaun sa hai, ma'am? Vaginous mein C ANCA, CPR. That is all that you have in World Cup, CPR. Baki everything goes under P ANCA. So this means vaginous can show you both, but World Cup mein vaginous most commonly tends to show you World Cup, ma'am. But vaginous can show you this. Microscopic polyangiitis, P ANCA. Short's syndrome, P ANCA. In fact, they will ask you any disease in intestine, ulcerative colitis, P ANCA. If they ask you any disease in the liver, primary sclerosing cholangitis, P ANCA. Anything on this planet that is asked is going to be P ANCA. Now, one of the latest screenshots that I've been getting from every student is, ma'am, other than ulcerative colitis, can Crohn's disease, can Crohn's disease sometimes show you P ANCA? Yes, it can. Okay, so the answer is yes, it can. But again, rare thing, but आजकल का trending GT question है which you are getting on every platform, so I want you to know this. मतलब ma'am, whatever comes in the exam, answer is always P ANCA. Only for vaginous granulomatosis, the answer is going to be C ANCA. Last वाला नहीं समझ में आया, Dr. Garima, be a little more precise. Last वाला what? Because there is a lag in the comments. So if you could just let me know क्या नहीं समझ में आया. This is an antibody which is of 2 types, C ANCA and P ANCA. These are the other names, and I'm telling you कौन से disease में कौन सा antibody. That's about it. So in vaginous you see both, but World Cup से you will know in vaginous you see more of C ANCA. All the other diseases show you P ANCA, including the 3 blood vessel problems, including ulcerative Crohn's and primary sclerosing cholangitis. Okay, with this now coming back, we are not done with the question yet, ma'am. Why was this vaginous granulomatosis? Because let's be honest, photo हमें नहीं समझ में आया, and I know you will not understand it in the exam also. So please note, whenever you get a question on vaginous granulomatosis, you are going to focus for 2 things. You will focus on 2 triads. ये ढूंढना exam में everyone. Ma'am, granulomatosis, GR, where are the number 1 chapter blood vessel, number 2 chapter is going to be lungs, and number 3 is going to be, okay, so remember it is blood vessel, lungs as well as kidneys. One more thing, you will find one more triad which we call as ENT triad. Who will fill in the blanks for me? Ma'am, number 1 is going to be E, ears में क्या होता है? Otitis media. N for nasal septal perforation, and what happens in the throat? Not the throat but the mouth. There is going to be excellent, there is going to be strawberry. Mouth में क्या होगा? Gums होंगे ma'am, so strawberry gums. Now you will say ma'am, I'm always confused with this. Nothing to be confused. ये वाले photo पे you didn't have to focus only. Every photo is not to give you a hint. Sometimes photos are to deviate you from the topic. If you had not even got this photo and you would have read it, so ma'am, could you see the first triad? Is there involvement of blood vessels? Of course, there is some involvement of blood vessels because patient is having anemia, bleeding, so blood vessel involved. Is there involvement of kidney? Of course, hematuria. Involvement of lungs, of course, there are nodules in lungs. Triad बन गया, blood vessel, kidney, lungs. It is vaginous. ENT में क्या दिख रहा है, ma'am? I can see nasal obstruction, so some amount of nose involvement is also happening. And कुछ भी नहीं समझ में आया तो C ANCA. There is only one disease with C ANCA, and that is CPR. Ma'am, World Cup के लिए CPR, which happened to us in the last World Cup also when we lost in the finals. So World Cup के लिए we needed CPR. मतलब vaginous granulomatosis के लिए C ANCA. C ANCA का दूसरा नाम PR3 ANCA. All of you will remember this. World Cup सबने देखा था finals. Unfortunately we lost. We needed a CPR. So World Cup CPR. So for those, I hope all of you who were saying कि ma'am अगर vaginous पे question आया and I have to select one, I have said it 1 million times. If you have to select one, World Cup is going to be your one answer. Okay, sorry for getting back some bad memories, but we will move forward from these memories. Now we will ask you a question which is away from vasculitis. Okay, which is the most likely diagnosis when a skin biopsy of a painful red lesion on the dorsal surface of the hands reveals round regular cells with connective tissue and branching vascular spaces? Okay, Dr. Dhruvraj, you wrote in P ANCA as well. Exactly. I don't know ये confusion कहाँ हो रहा है, क्यों हो रहा है? I'm not understanding. Vaginous बार-बार I am saying 10th time. Vaginous both P ANCA and C ANCA. I will write it once again so that there is no confusion. Veg nurse shows you both P ANCA as well as C ANCA. So if you have an answer of both, please select both. If you have to select one, then World Cup best. One answer select karna hua to C ANCA. Now no confusion. Okay, now let's go back to a question which is very hard. Pathology. Answer meanwhile I was getting angiosarcoma and glomus tumor. Okay, firstly ma'am, there are two hints over here. I can see there is dorsal surface of hand, one hint, and second very painful. Now firstly, lipoma. Lipoma is a fatty tumor, and fatty tumor can happen everywhere in the body, but fatty tumors are usually not painful. They are just incidental findings. कोई problem नहीं है. Dermatofibroma is not something you will get on the dorsal surface of the hand. Angiosarcoma, anyway, एक और चीज पढ़ो, vascular spaces लिखा था मैम, you have to focus on blood vessel problem. Derma, fibro, कुछ blood vessel नहीं है. Angiosarcoma is a blood vessel problem, but does it happen on the hand? No. Angiosarcoma, which organ does it happen into? Angiosarcoma, it can happen on the skin, but one organ where it occurs is liver. General path question: which are the three chemicals that cause angiosarcoma of the liver? Quickly let me know. One is going to be vinyl chloride, second one is going to be arsenic, and third one is going to be thorodust. Remember we have studied in our RR VAT chemicals angiosarcoma liver occurs. Ma'am, over here the only answer fitting it is glomus tumor. Glomus tumor occurs on the dorsum of the hand, especially which part of the dorsal surface of the hand? It tends to occur on the nail bed. मतलब it is going to be subungual. And second point, it is going to be very painful. मतलब यहाँ पर तो सिर्फ painful लिखा था. Patient comes to you saying excruciatingly painful. Patient will be shouting with pain. These two things written, it has to be a case of glomus tumor. Now you will tell me what is the origin. Another surgery question that I'm asking you. What is the origin of a glomus tumor? It is glomus bodies. And what are glomus bodies? Ma'am, यहाँ पर होता है fingertips पे होता है. Given you these fingertip bodies, they are AV anastomosis, arteriovenous anastomosis that is present. क्यों? Again, why has arteries and veins been made to anastomose over here? Because they want it to happen. They want you to regulate your temperature. Thermoregulation is what they want should happen. So remember, for thermoregulation, they have God has given you these kind of bodies. ये simple हो गया. This glomus tumor and वो ear वाला glomus tumor are not the same. One very important point in case you did not know. अलग-अलग. This is nail वाला, that is ear वाला, not the same at all. Okay, now let me move to the next question. The organ changes and everything. Pregnancy glomus? No, Dr. Ananya, glomus tumor doesn't have to happen necessarily in pregnancy. Pregnancy tumor is different. That is pyogenic granuloma, and glomus tumor is different. It can coexist, but not the clinching point for diagnosis. Okay, 70-year-old male brought to the emergency department by paramedics due to chest pain for 30 minutes. Patient has a history of advanced pancreatic cancer for the last 6 months. ECG shows inferior wall MI, and measures were taken, but patient did not survive. मतलब autopsy हुआ, autopsy पे vegetations आए along the mitral valve leaflets. These are the 4 options that you have. What are you going to select out of these? Yes, option C everyone is selecting. क्या diagnosis बनाया? Because over here, ma'am, MI तो can happen because of any kind of vegetation. But over here there is one hint given that is pancreatic cancer. You guys forgot that hint. Pancreatic cancer, and still you made rheumatoid and infective. Okay, so I'm still waiting. Pancreatic cancer. Let me teach you. देखो, these are the 4 vegetations. This everyone knows. These are the 4 kinds of endocarditis that you have. Okay, so as soon as I say endocarditis, ma'am, पहले वाला तो we are not going to forget rheumatic heart disease. How did you identify an organism? I will only tell you. Group A, beta hemolytic streptococcus. So it's a streptococcus का infection वाला problem. And look at these vegetations. They are very छोटा vegetations. They are small warty vegetations. Number 1. Next, infective endocarditis. This is also because of infections. But I can see, look at the vegetations. The vegetations are so big and bulky. Now come to the third one, NBTE, non-bacterial. Ma'am, this is nothing to do with the bacteria. Thrombotic endocarditis, matlab this is to do with the blood clot. This is to do with the thrombus. Why is the thrombus formed? Now there are 2 answers to that. If leukemia likha hota, then which leukemia causes DIC? Which leukemia causes thrombus? It is AML-M3. And if they write cancers, can pancreatic cancer? This is a medicine question, guys. Can pancreatic cancer, for that matter, even lung cancer, can they cause thrombus? Anyone who will give me the answer? Why lung cancer and pancreatic cancers are causing thrombus? Because the pathophysiology of medicine says that lung and pancreatic cancers, they release something called mucin. And ma'am, and you say ma'am, colon cancer also, na? So any cancer that releases mucin. Appendicular cancer, yes. Colon cancer, yes. Mucin creates thrombi. Mucin creates blood clots. So ma'am, thrombotic wala, any cancer that creates blood clots, that creates mucin, will be able to cause NBTE. And look at these vegetations, they are very fragile. Fragile matlab they will break. Common sense. Ma'am, thrombus bana to break hoga. Thrombus bana to it will break. It will form embolism. Coming to the last one, LSE, Liebman-Sachs endocarditis. And you know the disease. आगे पीछे करा, the disease that you know is SNE. How do you see the endocarditis vegetations? Upper surface पे भी है and lower surface पे भी है. Both the surfaces show you vegetation. LS, which is the more common surface is going to be the lower surface. And now let me come back to the question. I had a case of pancreatic cancer, lung cancer, colon cancer. Ma'am, जहाँ mucin release होगा, वहाँ your answer will be becoming NBTE, non-bacterial thrombotic endocarditis. Last question. Out of these 4, which of them is known as in medicine? Merantic endocarditis किसका नाम है? So instead of NBTE, if they would have called it merantic endocarditis, I would have written the same thing. Both of them mean the same. Let me ask you, were you listening? Were you sleeping? ये वाला बताओ. Actual patient image. Large, both surfaces है या thrombotic है? क्या type का vegetation यहाँ पे दिख रहा है? All of you will tell me. Quick answer. RHD, IE, NBTE or LSE? Ma'am, these are very large vegetations. Large vegetations का मतलब हुआ, this is a case of infective endocarditis. ठीक है? So anyone, Dr. Singh has mentioned that ma'am, this question I got wrong, so this means I'm weak in cardiopath. That is the kind of outlook I want all of you to have. There are 2 kinds of students. One who get this equation incorrect and say patho is not made for me, I am not made for NEET PG, my memory is bad, my life is bad, and everything is bad. Second set of students which I want you to be is who say that okay, this question is incorrect, this part of mine is weak. आज के class के बाद I will open the RR videos of this particular topic, I will read it and I will strengthen it. That's the kind of outlook towards life, and this I want you to have. Not the first one which I was telling you where students write to me that ma'am मेरा ही कुछ नहीं होगा. Some students have now started writing to me that few days back I was posting some photo, I visited somewhere, they said ma'am, why do you believe in God? God has not done anything nice to me, my GT scores are not improving. Don't be so radical, okay? Be a little positive about things. Okay, so yeah, this is large, this is going to be infective endocarditis. Very good. Let's move on to the next question. If I give you a spotter image, because इसके साथ with that photo, if that question, if this image would have come, what would you have marked it now? Will you call it RHD, infective endocarditis, or will you call it NBTE or LSE? So, Dr. Aditi, previous questions are not warty. देखो, warty तो हो सकता है because I can see they are definitely looking a little, like those warts. But look at the size also, na. The size is huge. RHD cannot be that big. RHD are small vegetations. This is huge. It is kind of extending down also. So this is a case of IE. Now let's go. This photo, all of you called it rheumatic heart disease. Why? Because firstly, can you see this cell, guys? Ma'am, ये एक cell है जिसके center में ऐसा dot है. That is owl-eye appearance. And I can see there are some cells where the nucleus is going like this, long में, caterpillar cells. Very good. So either ma'am, you will be calling them caterpillar cells or you will be calling them owl-eye cells. But they both mean the same. Both of them are what? They are the Anish cow cells. They all mean the same. Either it can look like a caterpillar or it can look like owl-eye. And ये पूरा body क्या बन जाता है? very good. It is going to be the ash of body, and ash of body is obviously seen in rheumatic heart disease. In fact, if they ask you most characteristic lesion of rheumatic heart disease is going to be the ash of body. So they will ask you what are the cells in ash of body? They are the Anish cells. Quickly tell me where else Auli appearance. जो दो Auli तो पता है. One is Reed-Sternberg cell, one is cytomegalovirus. The third Auli of your life I have told you which cell, that is Anish cell. Okay, now these set of questions are done. I can take you to the next question, which is a little tough but important. Which of the following statement is incorrect about fibrolamellar carcinoma? First, you should be knowing fibrolamellar carcinoma होता कहाँ है. So it happens in the liver. At least that hint will help you guess what is the answer that you have. Statement that you have. Okay. Okay, Dr. Soptic says, ma'am, the chordae tendon is intact, so you wanted to call it RHT. Okay, because वो destruction नहीं हो रहा था. The size. First, you focus on the size, guys. Look at the size. Maybe this is an early case. After a few days or weeks or months, it will cause destruction. But look at the size to begin with. They are huge vegetations. These kind of vegetations do not happen in RHT. After a few weeks, if you would have seen, it would have caused that destruction that you were wanting it to extend. And if you look very carefully, it is beginning to extend down also. So this is definitely IE. Please be rest assured. Okay, yes, I started getting answers. Option B क्यों बोला guys? इसमें पूछा गया था incorrect statement. You are telling me the correct statement. The incorrect statement is this: associated with hepatitis B and C. So I think we need to revise this question big time. ये सबका गलत हुआ है. So let me ask you. When I talk about liver cancers, there are two liver cancers that you have: classical wala and fibrolamellar. First, you will fill in the blanks of surgery of everything to do with classical. Ma'am, what age does it happen? Liver cancer obviously happens after 40, 50, old age में होता है. With gender, because alcoholism and everything is more in males, so this gender predilection more in males. Is it associated with hepatitis? Conventional wala HCC is associated with hepatitis B and C. Yes. What is the tumor marker? Everyone knows alpha fetoprotein. सभी को पता है elevated. How is the spread? It is via blood vessels. Means it is going to be hematogenous. And how is the prognosis? Liver cancer patients hardly or very rarely survive, so the prognosis is very bad. But when I talk about fibrolamellar, some of you are mentioning speed, ma'am. Please साथ साथ ये भी बता देना ना, speed बढ़ाना है कम करना है. I will not know just by mentioning speed के क्या चाहते हो. Okay, now let's come to the variant. Fibrolamellar variant. Fibrolamellar variant में ma'am सब उल्टा. The age is going to be ulta. Means this is going to happen in 19s and 20s, a very young age. Gender, there's no male female predilection, सब में equal. Is it associated with hepatitis? It is not. In fact, it is going to be a chromosome 19 deletion. It is a chromosome 19 deletion. Everything in fibrolamellar is 1919. Age is also going to be 19 years. Chromosome deletion is also 19 years. Alpha fetoprotein is not the tumor marker. The tumor marker over here is going to be neurotensin. It is going to be neurotensin. What is the spread? The spread is ulta, ma'am. It is going to be lymph. And the prognosis is going to be good. Okay, so everything becomes ulta over here. Now go back to the question. If fibrolamellar, is it chromosome 19? That is correct. Is neurotensin the marker? Correct. Does it come via lymphatics? Correct. Is it associated with hepatitis B and C? That is going to be incorrect. Okay, so that is the wrong statement that you have to pick up over here. Okay, let's move on to the next set of questions that you have, which is again a much expected question for your exam. A 60-year-old person presented with some stomach tumor having mesenchymal solitary mass below the mucosa of the stomach with intact mucus. Spindle-shaped cells and epithelioid cells were seen on biopsy. The tumor is positive for, and that is. Okay, so this is what are the options you have. Answers that I started getting over here are option 1, 2, 3, 4. That is going to be option number D over here. Okay, so let us figure it out. What is this tumor with these kind of answers? I knew that tumor to sabne bana liya. That is gastrointestinal stromal tumor. So now as I know stromal matlab what kind of a tumor is it? It's not a cancer. Carcinoma nahi hai. It is a mesenchymal tumor. First thing. What comes first? So the most common location is the cell of origin. Question of surgery. The cell of origin is going to be the cell of Cajal. What happens in the cell? There is a mutation that occurs called c-KIT or C1. Ma'am, because of this mutation, there is an increase in what? There is an increase in the tyrosine kinase activity. Treatment. I can inhibit that tyrosine kinase activity, and that is going to be imatinib. The treatment is imatinib. The mutation, wahi marker, that is CD117, or c-KIT is going to be the marker. Wahi marker is going to be CD34 and DOG1. So out of them, the next question is which of them is the sensitive marker, which is CD117. So wahi mutation, wahi marker, wahi sensitive marker. Whereas DOG1 is going to be what? It is a specific. Everything about GIST is settled. If I go back, CD117 is also known as c-KIT, CD34 and DOG1. All of these were the answers. But why did I think of GIST? Mesenchymal was mentioned. It's not a carcinoma, it's a mesenchymal tumor. You will tell me, jo bacha, CD99, which two places show you CD99 positivity? CD99 is also known as MIC2. That's the other name, favorite PYQ that they have. So CD99, we learned it occurs in that old wali granny. So old wali granny is going to be granulosa cell tumor. 99-year-old granulosa cell tumor. Granny की age में होगा, and MIC2 when it is a bone tumor, that is Ewing's sarcoma and granulosa. Nowhere else will you be studying CD99. Meanwhile, I read a comment. CLL, that could be a mistake of typing from your end, because other than GIST, imatinib is used in CML, Philadelphia chromosome wala chronic myeloid leukemia. Okay? Now can I move forward? Now because of this, I have got you stomach की बात हो रही थी ना, I've got pictures of stomach. Fill in the blanks for me. Number 1, there is a stomach ka problem. This is stomach. Patient is having a lot of edema, matlab protein losing problem. What is your answer in that case? Ma'am, the stomach has started looking like cerebriform. Stomach like a brain is going to be known as. Very good. This is a case of Menetrier's disease. Excellent. पहले focus on the first one, guys. Menetrier's disease. क्यों होता है? Options. TNF alpha increases, TGF alpha increases, TGF beta increases. क्या लिखोगे? So many alpha betas में से. It is an increase in TGF alpha. Before I proceed forward, एक general path का question आज खत्म कर लो. When they will write TNF alpha, you will think of no food and no appetite. So when you think of why appetite goes down, so that is no appetite, NA. When you will have TGF alpha, ma'am, that is when I think of GA, that is gastric. That is when I think of Menetrier's disease, right? That is when I think of Menetrier's disease. And when they will write TGF beta, बहुत fibrosis. बहुत fibrosis means this is going to be the most fibrogenic cytokine. Repeating, NA, no appetite, GA, gastric Menetrier's disease. बहुत fibrosis means most fibrogenic. So now coming back, we have GA for gastric Menetrier's disease. Ma'am, stomach is looking like the brain, so cerebriform. Microscopically क्या बढ़ेगा? It is going to be an increase in the foveolar cells. So there is foveolar cell hyperplasia that you notice over here, and that is the reason ma'am patient is losing protein. Patient can't absorb any protein. Protein is going out of the body. If protein is not there in the body, how will the patient present? With edema. पहला stomach का picture खत्म. This stomach का picture I think everyone knows. As soon as you see a leather bottle, you know the answer to this is Linitis plastica. They will ask you what is Linitis plastica? What is the name? What kind of a tumor is it? Remember? We have diffuse gastric cancer, the same golu tumor that you were telling me about. So when I say diffuse gastric cancer, the same golu tumor, matlab genetics mein ma'am golu will be gone, means there is a loss of E cadherin. All this we know already. That looks like a leather bottle. They will ask you that golu tumor mein that E cadherin wala shows you which cells. I can see these cells beautifully. That is this nucleus, ma'am, nucleus periphery pe chala gaya, ring ban gaya. These are what? Excellent signet ring cells. Who will tell me where in gynecology do you see signet ring cells? Where in gynae? Jaldi se bata do so that I can finish this off. One is this tumor above you and the other one is Krukenberg tumor, which I can get as an answer over here. Amazing. So Krukenberg also shows you the signet ring cells. So those stomach ka photos yaad rakhna. Brain wala menetrius hoga, leather bottle wala diffuse gastric cancer hoga, and if they mention anything about mesenchymal, then the answer is going to be GIST. So these are all your stomach related findings. Now let's come to the next question. PYQ, which I have changed a little. A 5-year-old child was admitted to the hospital with prolapsing rectal mass and painless rectal bleeding. Which of the following genetic alterations would you consider in your primary diagnosis? Answer I have started getting, and that answer is going to be SMAD4. Okay, so now firstly diagnosis में क्या बनाया? Ma'am, as soon as you said rectal mass, bleeding rectum, तो एक तो rectum में polyp है, and then you said there is a 5 साल का बच्चा, so there is a juvenile rectal polyp that you have. Note, remember everything about juvenile rectal polyp is juvenile, मतलब less than 5-year-old child होगा, and what will be the genetics? Ma'am, genetics भी less than 5 होगा, that is going to be SMAD2 as well as SMAD4. So juvenile में I selected SMAD4 because I thought it is juvenile rectal polyp. But apart from that, look at these other genes. So you will have to do a fill in the blanks for this also. Juvenile rectal polyp के लिए all of you told me ma'am सब कुछ juvenile, SMAD2, SMAD4 and less than 5-year-old वाला child. What is this Peutz and Jeghers? I think everyone knows यहाँ पर story आता है 11-11. Okay, before I start with that, Dr. Aditi says ma'am INICT के लिए BMPR4. Actually it's BMPR1. Again, I would say the numbers which are less than 5, all those genes, Dr. Aditi, you can safely place over here. Age be less than 5, genetics be less than 5. Peutz Jeghers में सब कुछ 11-11. What is the age going to be? It is going to be above 11 years of age, and the genetics is going to be STK11. The other name of STK11 is going to be LKB1 gene. So 11-11 यहाँ हो गया. Then Peutz Jeghers के लिए ma'am P for ये देखो, I always call her as examiner's crush because examiner always gives her photo for pigmentation. No one else's picture over here. So remember we have what? P for Peutz, P for pigmentation, JE for Jeghers, मतलब polyp कहाँ पे होता है? The polyp site is going to be JE for jejunum. This polyp everyone knows, and that is going to be the Christmas tree polyp. जल्दी से साथ-साथ लिखते जाना. Christmas tree cataract is something I would want to ask you. As you will type and I will get the answers, I will continue forward. But I know Christmas tree cataract, you guys will type and let me know. Now let's come to the next polyp syndrome. Cowden syndrome. Cowden का सब कुछ 10-10-10 चलता है. So what is the gene? It is going to be P10 gene. What is going to be the chromosome? That is also going to be 10. And what is the syndrome? It is going to be Cowden. And remember Cowden syndrome में ma'am again the syndrome has P10. So 10-10-10. What is going to be P10? N for what? It is going to be endometrial cancers. Fill in the blanks for this too. Endometrial cancers. T for what? Thyroid cancers. This to everyone knows. Tell me one tumor which occurs in the skin. ये derma में question आता है. Which tumor occurs in the skin? So tricky lemomas can occur in the skin. I hope you remember tricky. Tricky मतलब tricho. Tricho मतलब hair. तो hair का tumor होता है. And finally what you're reading ma'am polyps. So I'm reading over here. And P का in our RR we have always made a B out of it. So the next tumor is going to be breast cancer. These are all your Cowden syndrome. Happens because of P10-10-10. So P10 के साथ one more happens, and that is Benayan-Ruvalcaba relay syndrome. I've always told you this is because of P10. Until the time I will learn the name of Benayan-Ruvalcaba relay, I will go mad. Patient also goes mad. That is going to be mental retardation. Finally, Cronkhite-Canada syndrome. The only one where there is no gene. Very important question. Which is the only syndrome which is non-hereditary? Because I've always told you Canada जाना है. No one has given you PR ship in your family. You are on your own. You will go on your own. So it is nothing you got from your family. This means by the time you reach Canada, you'll be pretty old in life. That is, I don't hope that should be there, but usually that means you will be above 50 years because you've not got any PR ship from your family. So non-hereditary. So क्या होगा? मैम 50 years पे तो my skin, hair and nails, everything will go. My skin will be pigmented. My hair will be lost. My nails will become very thin. जो old age वाला problems होता है, same will happen in Cronkhite-Canada. So the question that I expect this time, either तो Peutz Jeghers, because हर बार Peutz Jeghers का question can come anywhere, or they can give you a question on Cronkhite-Canada asking you which is the non-hereditary hematomatous polyp, that is Cronkhite-Canada. Question will always be a patient who is above 50 years of age. Polyp seem to be done. जल्दी से question बता दो. This I've highlighted. You are not going to mess up. An above 11 मतलब 17-year-old child comes with a diagnosis of intussusception. Histopathology photo तो मैम हमने देख लिया. Christmas tree polyp. All of you gave me the right answer by the way. Christmas tree cataract was myotonic dystrophy. That's great. They've asked you which of the following is likely associated. So I've told you multiple correct. तो सब कुछ पढ़ लेते ना. Why did you all say only STK11? Question नहीं पढ़ा मतलब A and B. When you are saying Peutz Jeghers 11 तो ठीक है. But you forgot the pigmentation part. So A and B both are correct answers. I wrote it for you. Some of you said retinal pigment epithelium hypertrophy. No, that happens in FAP, not over here. And clubbing also not over here. Clubbing can happen with juvenile rectal polyp. For INICT students, clubbing can happen with juvenile rectal polyp, not with Peutz Jeghers. So these are the two answers that you had. Please, this is the mistake that all of you did. सबने देखा A answer कर दो. I highlighted this, and these are the kind of mistakes you're doing in the exam which you don't have to. I think this table is settled for all of us, and we can move forward to the next set of questions. Okay, so there is a middle-aged male patient with proteinuria, and based on the immunofluorescence below, what is the likely diagnosis and answer? If you see the whole spectrum over here, IgM, Ga, C1, C3, kappa, lambda, सब positive आ रहा है मैम. House party. House party मतलब SLE. Mean the kidney, of course, because proteinuria here we are dealing with the case of lupus nephritis. So all of you are going to settle it over here. When I say lupus nephritis, there are 3 and only 3 questions that they will ask you. सबसे पहले tell me, what do you see on light microscopy? L पे L दिखता है मैम. That is we see the famous vial loop lesion. If I ask you what do you see on fluorescent microscopy? F पे F दिखेगा. That is we are going to see full house phenomena, full house effect. What is full house effect? Full house effect मतलब सबका house party. IgG, AM, C1, kappa, lambda, सबका meetup हुआ, सबका meetup is house party. So fluorescence by I see full house effect. Electron microscopy is in front of you. It's looking like a thumbprint appearance. Remember L full house and electron पे thumbprint. So now tell me how many classes does lupus nephritis have? Lupus nephritis has class 1 to class 6. 7th वाला discover हो रहा है, but अभी के लिए books mention 1 to 6 only. And please note that the maximum vial loop lesions, the maximum vial loop. Remember, if I ask you vial loop, you will say ma'am vial loop lesions are seen in class 3, 4, 5. But maximum vial loop lesions are seen in class 4. Okay, 3, 4, 5 options में है तो select all, but maximum पूछा, then you are only going to select class 4. Okay, then we are settled with this. I can ask you the next question. TAM Horsfall protein is a major component of which of the following? Very important previous year question, expected this time also. TAM Horsfall protein is a part of, yes, renal cast is one answer. Some of you have started giving me, yes, especially कौन सा वाला cast? The first thing that we start with is hyaline cast. Some of you mentioned Bence-Jones protein. पहले तो let me settle that out. See, at least none of you thought thrombi तो blood clot होता है, वो तो नहीं है. Okay, blood will make blood clot, not TAM Horsfall protein. Kirschmann spiral तो मैम kidney में कहाँ Kirschmann spiral लेके आयो? Kirschmann spiral is something that you see in which disease? You see it in asthma. Remember 3 C's of asthma, so not over here. Bence-Jones protein is also not the answer because Bence-Jones protein is light chains in the urine. So this is something you should be knowing. Light chains in the urine is Bence-Jones. over here is renal cast, जो high lean cast, and that means all of you are going to identify the cast and give me the photo over here. Photo के साथ diagnosis disease बता दोगे. Ma'am, this high lean cast which looks exactly transparent, this is what is made up of tam horsefall protein. Where does tam horsefall protein come from in the body? It comes from kidney में कहाँ पे? From that loop of Henle. It comes from the loop of Henle. Where do you see it? Ma'am, this high lean cast urine में आया, normal है, nothing to worry. Maybe patient has little bit of dehydration or some छोटा मोटा fever. Overall, he's not dying, and I'm not at all worried about it. Now, when that cast gets red cells, I am worried because RBC cast is seen in glomerulonephritis, and if there are white cells, then white blood cell cast is seen in pyelonephritis. RBC cast, glomerulonephritis, white blood cell cast, pyelonephritis. बिल्कुल brown color का cast हुआ, everything has died मतलब. I am dealing with the case of ATN, acute tubular necrosis. What history will I get over here? Muddy brown cast के लिए मैम necrosis, कुछ तो poisoning हुआ. Either the examiner will give you a mercury poisoning का case, or the examiner will give you ethylene glycol poisoning का case. Examiner इतना अच्छा नहीं है ना, he will say your patient has ethylene glycol poisoning. Please tell me what cast will be made. He will tell you the company that he's working for or the products that he's working for. So where is ethylene glycol used? It is used for making car freeze products. कार फ्रीज प्रोडक्ट्स या एंटी फ्रीज प्रोडक्ट्स जो कार इंडस्ट्री में यूज होते हैं ना, कार इंडस्ट्रीज और इवन रेफ्रिजरेटर इंडस्ट्रीज, ऑल दीस एंटी फ्रीजिंग प्रोडक्ट्स जो होते हैं, कार इज जस्ट वन. दे विल फोकस ऑन दिस वर्ड कि एंटी फ्रीज प्रोडक्ट्स व्हिच आर यूज्ड इन द कार्बोनेटर्स, व्हिच आर यूज्ड इन रेफ्रिजरेटर्स, उनमें वी हैव एथिलीन ग्लाइकॉल. दैट इज द काइंड ऑफ पॉइजनिंग दैट कैन हैपन टू वर्कर्स. Then their kidney will start showing you muddy brown cast. Finally, look at this, that broad cast. Broad cast is a feature of renal failure, chronic renal failure. So 10-second revision, highly normal है. RBC is glomerulonephritis, WBC is pyelonephritis, brown color is everything dead, poisoning, ATN, and broad cast is going to be CKD or CRF, whatever you want to write. Dr. Ayushi, you are right. अब cast करें and crystal नहीं करा, session will be incomplete. जल्दी से all of you will tell me these crystals. I've written it for you. Please keep telling me. I'll erase the answers. जल्दी हो जाएगा. When I see a crystal which has 6 sides, तो 6 वाला cysteine होता है मैम. The 6 वाला is going to be cysteine. Very good. This you know. Next one. If I see very very thin needles, तो thin needles में हमारा tyrosine आ जाएगा. So thin tyrosine. Okay. धतूरा वाला मतलब मैम the crystals that look like apple thorn. So A for apple thorn and A for ammonium biurate. Obviously examiner will not write patient has ammonium biurate condition. No, what will examiner write? Examiner says patient has done a laxative abuse. So laxative abuse के साथ क्या बनेगा? Ammonium biurate crystal. A for ammonium biurate, A for dhatura wala, thorn apple, apple thorn. Now coming to your calciums. Obviously Mona is dumb, no one forgets. So which is the one that is double shape? Mona ma'am, that is calcium oxalate monohydrate. Which is the one that is going to be envelope? ये देख लो यहाँ पे zoom in करके. Which is the one that is envelope? That is calcium oxalate dihydrate. So Mona is dumb is your favorite mnemonic on the calcium oxalates. Finally we come to this, that which is the one that is going to be broken chips. Ma'am, broken chips में cholesterol होता है, so those are going to be the cholesterol crystals. Now the one which can show me any goddamn shape on this planet, triangle, rhomboid, rectangle, square, कुछ भी चलेगा. Universal shape किसका होगा? Uric acid का होगा. तो uric acid में means they will always give me a history of hyperuricemia, that is gout. Okay, coming to the next, the one that looks like a coffin lid. This is a coffin and ये उसका lid. Coffin lid is going to be triple phosphate, and I think this everyone knows that the other name of triple phosphate is going to be the struvite crystals. And also if I have to ask you that what will these crystals later on form in surgery, which kind of renal stone? So that is going to be the staghorn stone. In the first part of this class I told you which breast FNAC shows you staghorn clusters. So the breast FNAC is fibroadenoma, and which stone is seen? Staghorn stone का क्या composition है? Triple phosphate. And which is the bacteria that causes it? That is going to be the Proteus bacteria that causes this staghorn stone. But so day after tomorrow we are going to do bacteriology, so I'm prepping you up for that. Now, all your casts and crystals are done. I can make you move on to the next question, which is one of the easiest, but I want to have a lot of discussion on this question. 10-year-old boy is brought to your clinic with mother complaining of blood in his urine. The mother said that few days ago the child suffered a throat infection. She's not given you a proper time frame. Physical examination shows mild edema and hypertension. Based on the following findings, the diagnosis of how is the diagnosis of PSGN is made. Based on which of these? क्या दिखा होगा? I started getting answers of. Very good. A, C and D. I don't know why so many different answers, but answer is very clear cut over here. That is starry sky appearance. Before I start, starry sky appearance is number 1 seen in PSGN. Tomorrow in hematology we will see starry sky appearance in Burkitt's lymphoma, and अपना radiology में you will see starry sky appearance in neurocystic causes का भी starry sky appearance होता है. So now firstly this is the case of PSGN because PSGN occurs in, quickly letting you know, PSGN occurs in P for pediatrics. तो यहाँ पे your patient had a 10-year-old boy था ना, तो वो ठीक है मैम. What color urine? Everyone knows. Mother is saying my child is passing cola color urine. What do you see on the kidney? I can see these red color dots which are going to be the flea bitten kidney, and that is what you analyze over here. Flea bitten kidney. ये वो फोटो है starry sky appearance which all of you say मैम कभी समझ में नहीं आता. Firstly immunofluorescence है, this you can understand. Yes. Now let me know, is this going to be a just look at the glomerulus वाला part, इतना वाला part. Is it green everywhere? Yes. But some areas are little less green, and look at some areas they are as if stars are shining into your eyes. तो ये वाला area, ये वाला dot मैम बीच-बीच में shine कर रहा है. So what is that? That is going to be the starry sky pattern. So when you see a छोटा बच्चा with cola urine, flea bitten and starry sky appearance, that has to be PSGN. For NEET PG students especially, can you tell me microscopically deposition is where? Microscopically deposition is going to be subepithelial humps. Okay, someone asked me, ma'am, I have read subendothelial also. Deposition can occur subendothelial and subepithelial, but what I want you to learn as the single best answer is going to be subepithelial. I'll repeat starry sky, Dr. Harsh. It's very simple. You know, you've seen, unless you stay in Delhi, then you've not seen stars. But if you stay outside of Delhi, then you've definitely seen stars. So you've seen stars shine in the sky. अलग से the stars twinkle. तो यहाँ पे देखो, the green color is shining. There is one shiny area here, one shiny area here. So you will suddenly see there are some tiny stars or some shiny areas coming in between. That is what you call as starry sky appearance. Okay, so that is otherwise settled for you. Okay, now we are done with this, ma'am. ये पूरा जो history था ना, this happened in a छोटा बच्चा, pediatric. You convert it into a बड़ा person, that is you convert it into an adult, and that is going to be IgA nephropathy. Same history of cola color urine, same happening, but IgA nephropathy का क्या नाम है? Burgers without a U. I taught you one Burgers sometime back with a U जिसका नाम था thromboangiitis obliterans. This is different. Ma'am, everything is same cola color urine. You said age change हो जाएगा adults में. And दूसरा, what is the antibody deposited? It is going to be IgA1. Where is it deposited? That is going to be very good. That is going to be in the mesangium. Amazing. All of you are writing it. After some time, you're going to write it at one place with me. So PSGN it is going to be, it's going to be subepithelial, and IgA it is going to be in the mesangium. Now coming back, यहाँ तो definitely PSGN था. They change it into a 40-year-old person and give you this kind of history. I will go more in favor of Burgers. But tell me, बाकी सारे also. Where do you see this effacement of food processes, ma'am? This is a complete change. This is something we see in minimal change disease. वो nephrotic syndrome है. Minimal change disease shows you effacement of food processes. Where do you see spike and dome pattern? Spike and dome pattern is going to be MGN, membranous glomerulonephropathy, and tram track appearance is going to be MPGN. So I want you to see these three photos also. Have a look at this, guys. Number one, what is this? Minimal change disease, effacement of food processes. So पहले ये photo देखो. देखो, same photo will come in the paper, so you cannot mess up. These are two pictures that you have. The first picture on the top is a normal electron microscopy where you can see these nice foot processes, right? Whereas in the next photo, ma'am, flat line. ये जो foot processes हैं, what have they occurred? Flat line मतलब इनका हुआ है effacement. So now tell me, this is minimal change disease मतलब minimal age में होगा, ma'am. This occurs in a 2 to 6 years old person. This point यहाँ तक it was common for NEET and FMG students. One point I'm going to tell you, for NEET students, effacement of foot process other than minimal change disease जो बच्चों वाला था, can it happen in adults? In FSGS also, yes, it can happen in FSGS as well. Please do not think otherwise. बच्चों में भी होता है, adults में भी होता है. So this will never, both will never be there in the options. Just in case both are there in the options, then look at the age. If it's a child, it's minimal change disease, and if it's an adult, then it's going to be FSGS. ठीक है, this is settled for all of you. Ma'am, तो अगर यहाँ पर ऐसा वाला question आया which you just made us mark over here. So just give me a second. I think it's taking. Yeah, this is the question. So look at this. A 33-year-old male presents with nephrotic range proteinuria. He had history of radiologically confirmed reflux nephropathy. Renal biopsy and immunofluorescence अभी आया नहीं है. Pending. Pathologist has gone on strike. Which of the following is the most likely working diagnosis? So all of you will say that, ma'am, यहाँ पर answer में तो कुछ दिया ही नहीं. No effacement, no renal biopsy. Answer is still FSGS. So now listen to the entire story again. And I got a question from Dr. Someone. I couldn't read your name, but luckily I could read the question. कि ma'am, इनमें से which of them is associated with Hodgkin's lymphoma? So please listen to my story once again. When I'm talking about nephrotic syndrome, एक है minimal change disease, which you said occurs in very छोटा बच्चा, and one is FSGS, which occurs in adults. If you get a history of anything to do with two things, number one, anything related to allergy, atopy, allergy, वो वाला situation, then also minimal change disease. Anything related to Hodgkin's lymphoma, then also minimal change disease. Actually, the problem is we don't know the pathogenesis of minimal change disease. So all these random diseases, if they want to link up with something, they will link it up with minimal change disease. And I've told you how do you do the diagnosis? Flat line, ma'am, foot process, chala gaya. So that is the effacement of. Whereas in adults, we call it FSGS. And what are the 6 questions you get on FSGS? Ma'am, we learn it by the mnemonic HRs 321. HRs 321 मतलब 3 H's. Everyone. First one, HIV patient में FSGS, hypertension में FSGS, heroin drug abuse में FSGS. ठीक है? What are the 2 R's? Either there is a reflux in the kidney or there is a renal tissue loss. In your patient over here, there was a reflux. As soon as you read any of these 6 histories, your answer is FSGS. And finally, the S is for sickle cell anemia. आजकल ये sickle cell anemia questions are very famous. If they ask you what happens in the kidney, obviously you will write FSGS. If they ask you sickle cell anemia patient में osteomyelitis है, तो कौन सा organism causes osteomyelitis? It is Salmonella enteritidis. So please remember osteomyelitis. पूछा. I'm just telling you random questions of sickle cell anemia. Number 1 kidney पूछा तो FSGS, and अगर osteomyelitis पूछा, usually when they ask you the most common cause of osteomyelitis, that is Staph aureus. In all other cases, but in sickle cell anemia the answer is going to be Salmonella. Okay, चलो, now I can move on to the next one. Someone said, ma'am, cancers के साथ और कौन सा होता है? So that you will tell me. Look at these 2 which are left. Can you label? I've given you the diagnosis, I've given everything. Just tell me the name of the disease. Tell me the first one that you have over here is membranous glomerulonephropathy, and the other one that you have over here is going to be MPGN, membranoproliferative glomerulonephropathy. So ma'am, in membranous glomerulonephropathy we see the spike and dome, spike and dome, spike and dome. तो क्या and क्या होता है dome? Firstly, we can all see some spiky stuff which is going up. So this spiky stuff which is going up is ये वाला basement membrane. This basement membrane decided I want to become like that spiky hairstyle of boys. So remember, the spike over here is nothing but the basement membrane. And when I say dome, the dome over here is going to be immune complex. ठीक है? तो spike and dome में, now you will ask me, ma'am, spike is basement membrane, समझ आ गया? Dome is going to be immune complex, where over here also this is going to be subepithelial. Please note, how will I learn this? Membranous glomerulonephropathy is the most common nephrotic that you see in old age, and it is the most common nephropathy that you see associated with cancer. So please note this over here. बहुत old age में, at the peak of age, what pattern will you see? Peak of pattern. याद हो गया? Peak of age पे, ma'am, peak of pattern दिखेगा. कहाँ पर? Subepithelial. What do you mean by subepithelial? If I may ask you, I will again draw. What are these, ma'am? ये थे foot processes. These were the foot processes if you had shown us. Now foot processes से related 2 questions all of you are going to tell me. Foot process is nothing but podocyte, right? And the other name for this is epithelium. This is nothing but the epithelium. So when I say that the deposit is subepithelial, it's occurring feet के नीचे. It's occurring epithelium के नीचे. So who touches the feet? Kids touch feet. Kids में क्या होता है? PSGN. किसके feet to be touched? We touch feet of elderly people. What happens in elderly? MGN happens. So which are the 2 diseases that are subepithelial? छोटा बच्चा वाला and elderly वाला. छोटा बच्चा touches the feet of elderly person. So PSGN and MGN show you subepithelial. मतलब the foot process that is subepithelial location. On the other hand, they say foot process ऐसा flat हो गया. Flat line का क्या मतलब? Flat line मतलब मैम, they are talking about effacement. That I've already told you. Effacement will occur in number 1 minimal change disease, and number 2 it will occur in FSGS. Now I believe you guys should not make a problem in which is subepithelial and which is others automatically become the other way around, subendothelial. So subepithelial क्या होता है? छोटा बच्चा and elderly person. Let me come back. The story is not over. So ma'am, MGN में spike and dome pattern I have understood. Now you will tell me that MPGN, I have added one word, membranoproliferative glomerulonephropathy, and we see that the basement membrane has duplicated. Double line आ रहा है. What is this double line? Splitting of basement membrane. That is what you call as tram track appearance. If I would say splitting में तो ma'am I've understood railway track मतलब 2 tracks. Radiology में tram track appearance in the lungs, where is it shown? I think we all know it is seen in bronchiectasis, right? Radiology में lung में bronchiectasis appearance, patho में tram track appearance is seen in MPGN. Which one? MPGN type 1 or MPGN type 2? It is seen in MPGN type 1. 2 does not show any of these tram track appearances. Now coming to ये तो photo हो गया. Should I put in something to do with medicine, because that is where the twist will occur and you guys will fall for that. वो last यहाँ का tough वाला question है. This is the answer that you will give me. There is a 45-year-old female presented with rheumatoid arthritis and is being treated with penicillamine. In checkup, patient is found to have proteinuria. Microscopy of the renal biopsy is shown. Abhi I have not shown you that for a reason. Which of the following is likely associated with her condition? Without the photo first, can you give me an answer? Then I will give you a photo. उसके बिना, can you give me an answer? I started getting option A. Okay, A and D में से answers I started getting. अच्छा, पहले क्या बनाया मैम? Over here you had a patient of rheumatoid arthritis. Her drug that she's being kept on is going to be penicillamine. Okay, so at least all of you decided we will make a diagnosis of membranous glomerulonephropathy. Why? Because membranous glomerulonephropathy exactly जैसा RR में tried it one more time, because all of you have made a very major blunder over here. Most of you, not all. Correct answer is going to be D, and I'll tell you how. Remember, primary होता है MGN and secondary होता है. Primary मतलब मैम, it is said to be idiopathic, where you don't know exact reason क्या है. There are some antibodies, but I don't know the reason. Which antibodies? All these antibodies are known. That is the Robbins 10th edition update. That says antibodies against phospholipase A2 receptor, antibodies against thrombospondin, and antibodies against CD10. All of these antibodies can be seen, but do I know the reason? I don't know the reason. यहाँ पर guys, the reason was given. The patient is having this problem not because of idiopathic situation, because of penicillamine, because of drugs. So remember, drugs, cancers, and all these things go under the secondary type of MGN. So please remember which of the following is likely associated with her. Once penicillamine has come, then you can't call her antibody related. Then these 3 are not. or that is not associated in her condition. If it is because of penicillamine, then you say, अच्छा ma'am, then this means MGN, elderly, पैर छूना मतलब where is the complex going to go deposit? It is going to be subepithelial. So actually देखा जाए तो all four options were right in their own way. But I would have selected, if they would have asked me idiopathic case of MGN, I would have selected these three antibodies. Here they gave me a reason, and with the reason, I will never ever select idiopathic as my answer. Who are twist in the question? Despite knowing every word, we still make mistakes. Precisely why we solve questions, that we should know where all we make mistakes. Dr. Harsh will repeat it again. All these four options are correct options for membranous nephropathy. Membranous glomerulonephropathy can happen because of antibodies to phospholipase A2 receptor, antibodies to thrombospondin, antibodies to CD10. But why are these antibodies forming? I don't know. No one knows. This is idiopathic. हम में से किसी को भी नहीं पता why these antibodies are forming. But in this patient, reason पता था ना, penicillamine. If you know the reason, this is drug induced. Do you want to select these three options? You don't want to select these three options. Then what will you select? What is the next best answer that you can select in MGN? What is the deposit? The deposit is going to be subepithelium. अभी पढ़ा था ना वो पैर छूने वाला story. So then the best answer in that case is option D. Okay, why cancers? There are multiple cancers, that lung cancer, colon cancer, melanoma. They release certain substances which are going to go in, or some antibodies and some damaging substances which go and damage the the lining of the kidney. They go and damage the glomerulus, and that is why this tends to happen. Okay, so I think this is settled for everyone. Perfect, good question. अगर इसके साथ photo होता तो कौन सा वाला photo होता? ये वाला photo होता, because they were wanting to give you a hint of MGN. MGN में कौन सा photo देंगे? They will always give you the spike and dome pattern. I hope everyone is happy with this question, and these kind of छोटा intricate detail kind of questions you will be reading next time also. Okay, चलो let's move on to the next question that you have over here. Simple one. A case of neurodegenerative disease, which is the most common cause of dementia in humans. You understood the disease, and there is a biopsy and there is a finding that is shown over here. Which of the following best describes इसे क्या बोलते हैं? This is known as the tau protein. No one can ever go wrong in this. पहले तो remember, what did you think of, ma'am? As soon as you say dementia, what comes in my mind is Alzheimer's, and Alzheimer's shows me A beta amyloid. बिल्कुल show करता है. But is this the photo of amyloid? Not at all. This photo is what? This photo is a flame cell. And look at this picture over here. When I'm talking about Alzheimer's disease and I'm talking about flame cells are made up of tau protein. The story of Tauji everyone knows. Tauji वाला जो disease है, that is Alzheimer's old age वाला disease after 70. What other than flame cells do you see? You see these bodies called Hirano bodies. What is the composition of Hirano bodies? It is going to be actin positive, because we all know Tauji in our family always acts as hero, and hero क्या करता है? Acting करता है. So all these Tauji, hero, acting, all of them will come under what? They will come on Alzheimer's disease. Tau is on fire. You are right. So tau protein is on fire. मतलब Tauji is on fire. Flame cell. Tauji becoming a hero and doing acting. मतलब Hirano body is going to be actin positive. Now one question again for INICT aspirants and NEET PG, not important for FMG. Remember Alzheimer's disease का genetics also they are asking you nowadays, not just the Alzheimer's का usual tau and all. So they are asking you, number one is trisomy 21. Go back. This so everyone needs to know. FMG students also know Down syndrome, trisomy 21 में मैम Alzheimer's हो रहा था. So this is number one associated. Number two, there is a gene called PS1 and PS2. PS is not your PlayStation. It is the presenilin gene. It is the presenilin gene 1 and 2. And I think ये common sense होगा. Senile याद रहेगा. Senile मतलब old age, मतलब it is associated with Alzheimer's. Okay, so remember trisomy 21, PS1 gene, PS2 gene. These are the genes that are being associated with Alzheimer's disease. Very good. This you all know. And the next disease also you read, Parkinson's disease. Ma'am, Parkinson's disease में all of us can see which part of the brain has been shown over here. If we zoom in and see, in Parkinson's disease, they will always show me the substantia nigra. Okay, they will always show me the substantia nigra, and not brown because it has melanin. But what happens in Parkinson's disease? If I look at this over here, in Parkinson's disease, look at the substantia nigra. It's become very pale. Melanin gayab. Why has the melanin become gayab in Parkinson's disease? Because Parkinson's disease ka what is the pathophysiology? There is a decrease in the dopaminergic neurons. That is why the patient has all those gait problems, tremor problems. So remember, there is a decrease dopaminergic neurons. My basic biochemistry tells me that once the dopa will decrease, the pigment that will decrease will be melanin. This is also settled. Now, how does this look like under the microscopy? ये photo देख लो, all of you make a mistake. So, ma'am, in the exam only this will be given. How will I know this is substantia nigra? Because thoda melanin I can see, a little is left. So this is probably substantia nigra of the brain. And then I can see a round body. That round body is the Lewy body. All of you are right. Lewy body is made up of alpha-synuclein. So I'll never make a mistake if I come back to this question now. So Alzheimer's disease में क्या था? Tau protein था. Where do you see alpha-synuclein? Ma'am, alpha-synuclein is seen in Lewy bodies, and Lewy bodies are seen in Parkinson's disease. Who will tell me? NEET PG students and even FMG का तो PYQ है. Where do you see ubiquitin? Ubiquitin deposition. I'll give you a hint. In one nucleus of the caudate nucleus of the brain. Caudate nucleus of the brain. Caudate में मैम एक ही disease हमें पता है, that is Huntington disease. Now tell me, when I talk about Huntington disease, सारा कुछ general path medicine सब कुछ बता दोगे. So please remember, Huntington disease में hunting in a cage. Hunting in a cage मतलब मैम CAG repeats था, and cage में E मतलब this was happening in the axon. Cage का 4 walls होता है, तो 4 walls मतलब it's going to be chromosome number 4. Now you already told me that the nucleus affected is caudate. What deposits in the caudate nucleus? Number 1 protein is Huntington. कोई नहीं पूछेगा ना exam में Huntington protein is deposited in Huntington's disease. They will not ask you. They will ask you which other protein, and that is going to be the ubiquitin. So please remember, ubiquitin and Huntington are two proteins deposited in Huntington. अब सारे ना proteins. I know many of you were telling me मैम थोड़ा confusion होता है. So quickly tell me, when they talk about tau protein and they talk about actin protein, Tauji and actin wala, all of you will think of Alzheimer's. When they talk about alpha-synuclein, obviously you will all think of Parkinson's disease. And when they talk about Huntington and you will also talk about ubiquitin, then you will be talking about the Huntington disease. This is the final day wala protein that you should be doing. Someone said, ma'am, I'm very confused with images, not just of CNS but in general of path and micro. One RR पढ़ो. RR के बाद, if you see, once you're done with 19 hours of RR, if you open the app, after 19 hours are finished, you will see a 4-hour video discussion of images. Read them as many number of times as you can. Now that is something that I leave to you. How many times can you go through those images? Because if you know it's your weak point, then you work on it. Right after your RR, you will find 4.5 hours of images. Go through that. Okay, now we come to the next question. Let's pick up this one, which I personally expect this time. There is a 22-year-old patient who presents to the clinic with complaints of hearing loss. Audiometry has shown SNHL, sensory neural hearing loss, and MRI shows multiple meningiomas with vestibular schwannomas. Which of the following is the most likely diagnosis? Answer to it, I started getting easy wala tha NF2, पर ये हर बार का question है, I had to discuss. So firstly, we have two syndromes. One is neurofibromatosis 2, one is 1 and one is 2. So NF1, NF2. दोनों का chromosome बता दो. NF1 gene is present 17 and 22, ma'am. NF1, NF2, 17, 22. Now, what is the other name of NF1? NF1 is named after scientist. It is known as von Recklinghausen disease, right? Von Recklinghausen disease. And what is NF2 known as? That is the question over here. Bilateral vestibular, okay, bilateral vestibular schwannoma. So can you tell me what is the radiology finding of bilateral vestibular schwannoma, which I've got you over here also? That is the famous ice cream cone appearance, right? ice cream cone appearance that you see on the radiology of this bilateral vestibular schwannoma. Number one sign. Number two क्या होता है मैम pathology. So when I'm talking about a schwannoma, pathology will always be the same. It shows you two bodies. It shows you antony A and antony B. Antony A क्या होता है? A for a lot of cells and B क्या होता है? Blank. So if they ask you which is the hypercellular area, बहुत सारे cells होते हैं मैम, a lot of cells, that is antony A. Which is hypocellular, blank है, so ma'am this is going to be antony B. Now what else? You see verruca bodies. This is one verruca body. Do you think they'll give you a stupid question like verruca bodies are seen in schwannoma? ऐसा नहीं आएगा. They will not give you this photo also. They will describe. These days you are getting IBQs minus image. Image based question आता है जिसमें imaging नहीं होता. They describe the image to you. They want you to see. They want to notice. Have you actually understood the image? ऐसे रट्टा लगाया. So now if they ask you what is the description of a verruca body, all of you will write there are two rows of palisading cells. There are two rows of palisading nuclei, and you can see those two rows over here. एक row यहाँ पर है, एक row यहाँ पे है. So there are two rows of palisading nuclei, and what do you have in the center? Ma'am, in the center we have the cytoplasm. So now look at this. Do you have this one row of nucleus and one row of nucleus, and you have this cytoplasm in between? That is what is a verruca body. So my next question to you before I finish this, let me ask you from this question point of view. Ma'am, इसमें schwannoma के साथ patient also had meningiomas. So can you tell me what is the mnemonic which miss me? So what is miss me? Miss me is multiple schwannomas. सबसे पहले the patient will have multiple schwannomas. The next patient will have what is there in this question also. Patient will have meningiomas, and the third thing will be ependymoma. So that is what you know for miss me mnemonic. NF2. So broadly if you see three tumors, schwannoma, meningioma and ependymoma. That is why this was a case of neurofibromatosis type 2. I just want to randomly ask you two more questions. Can you tell me tuberous sclerosis in the heart, what is the tumor associated? Tuberous sclerosis in the heart is going to be rhabdomyoma. And what are the cells of rhabdomyoma that you see? Because there's a lag, I'm answering myself till but I want all of you to type. So tuberous sclerosis, heart mein rhabdomyoma is going to show you spider cells. Can you tell me VHL disease, VHL syndrome or VHL disease? 3 alphabets is going to be deletion of which chromosome? Deletion 3, VHL3. And what is it going to result in? Which kind of renal cell carcinoma? Ma'am, it is going to be clear cell RCC occurs with VHL disease. These are some other PYQs of NEET and FMG that I have written for you over here. Okay, now I think we can move forward. All of you were asking me questions related to a lot of proteins. So let me ask you one more protein related question. There is a 12-year-old boy brought to the clinic with complaint of headache, especially when he wakes up. Recently got difficulty seeing the board in class, so vision problems have started coming. Episode of unconsciousness is there. Photo कुछ दिया हुआ है, and they have said the most common primary benign brain tumor in children he is suffering from. What is the composition of the fibers shown? This is where you thought they will ask you the disease ka diagnosis, but they twisted the question. I started getting answers of A. So ma'am, anyway by ruling out tau protein you had said Alzheimer's, alpha-synuclein you had said Parkinson's, ubiquitin you had said Huntington. So now by ruling out also we say this is GFAP. But then what disease is it? Very good. This is a case of, if I would have asked you see the diagnosis is a case of pilocytic astrocytoma, and they have given you both questions are same. एक में protein पूछा and diagnosis पूछा. So now let write it down for you. When they are talking about child brain tumors, so now I'm going to discuss for the next 5 minutes brain tumors. Okay, when I talk about child brain tumors, there are two. Pilocytic astrocytoma, where because patient का prognosis 100% excellent, पूरा survival है. It is a grade 1 low grade tumor. I'm not worried. The other is medulloblastoma, where I'm very worried because this is a very high grade tumor, grade 4. This mnemonic everyone remembers. Anything blast happening is bomb blast, very bad. So medulloblastoma very bad, glioblastoma very bad. Any other new blastoma tumor in the exam very bad. All blastomas are very bad. Okay, so this is good and this is bad. दोनों में और क्या common है मैम? Both of them occur in C for child and both of them occur in C for cerebellum. So दोनों child में होंगे, दोनों cerebellum में होंगे. So now you understand my job becomes so crucial because I have a child with a tumor in the cerebellum. Either I can give this diagnosis and make the patient very happy, or I can give this diagnosis and make the patient very sad. So now the onus lies on me whether I have to make him happy or sad. I will have to look at these photos. So if the radiologist says that this is a cystic lesion, the third C of pilocytic astrocytoma, cystic lesion in the cerebellum, then I think more of pilocytic astrocytoma. And pilo matlab hair, so something hair like I will see, and that hair like is known as the rosenthal. These pink color fibers are rosenthal fibers. So now my question is, what are rosenthal fibers made up of? This is only for NEET and INI, not for FMG. FMG students 10 seconds ka break le lo, theek hai? So when I say rosenthal fibers, you have two proteins and two ins. Matlab ma'am, GFAP is a protein, HSP is the heat shock protein, so two proteins, ubiquitin and crystallin. So now let me come back to the question. Over here you had ubiquitin also in the option, but you had to select the single best answer, and single best answer is GFAP. No one selected ubiquitin because itna soch nahi rahe the. Now I want you to think, if this is an INI question with multiple correct options, then your answers will become A as well as D. If it's a single best answer, your answer will be option A. So remember, rosenthal fibers are made up of GFAP, HSP, ubiquitin as well as crystallin. Now tell me what is the genetic diagnosis over here? Genetics क्या होता है? Ma'am, over here we say number 1 is going to be BRAF fusion or BRAF mutation, BRAF V600E mutation. But आजकल something more even beyond that. It is going to be BRAF Kia fusion. BRAF Kia fusion is, again you will say ma'am दोनों options में हुआ. You can mark both. Both BRAFs are seen, but if you have to select only one, then for one you will have to select the fusion. For pilocytic INI question expected is this. Now I want all the FMG students to come back into discussion. Remember, child cystic cerebellum and क्या fibers दिखेंगे? Rosenthal fibers. बच्चे को diagnosis दिया, बच्चा very happy, surgery, he survived, he's very happy. When do you give the diagnosis of medulloblastoma? So remember, medulloblastoma diagnosis is given when Homer-right pseudorosettes are seen. So now this means ma'am, your next all-time favorite slide is going to be the rosettes. Pseudorosette क्या होता है ma'am? When something is hiding, fake thing is hiding inside your heart, that is going to be pseudorosette. When you have a clear heart, मतलब clear center, that is going to be true rosette. So as I always say, the friend who's told you that he or she has done 10 revisions, that is a pseudo rosette, a fake friend, because she has something, he or she has something hiding in the heart. A friend who has told you that मेरा भी एक ही या दो ही revision हुआ है maximum, otherwise I am also forgetting everything every day. That person clear heart, that is a true person. Keep true people in your heart, in your life right now. So which is the only true rosette? Flex nerve, intestinal true rosette. Ma'am, look at this. The center is white.